Hello, this is Professor Tiam. In Unit 10, Module 1, we'll be talking about the older adult in society. These are the sub-competencies we will cover in this topic. By the end of the lesson, you'll be able to identify what influences aging, describe what health and wellness look like in later life, recognize global aging trends, compare how aging outcomes differ across groups, and apply the nursing process when caring for diverse older patients. On this slide, you can see several factors that influence aging: diet, exercise, smoking, alcohol consumption, environment, stress, sun exposure, genetics, medication, and disease. Aging is highly individualized. These factors don't affect everyone in the same way. Research has shown that lifestyle and environmental influences can be more powerful than genetics alone. For example, a study of identical twins found that sun exposure and smoking had some of the strongest effects on physical aging. Other influencing elements include level of physical activity, social engagement, stress management, employment, and financial stability, and overall, of course, the health history of the adult. As nurses, it's important to remember that no single factor determines how a person ages. It's the combination and interaction of many variables over time. In later life, health is defined mainly in terms of functional ability rather than just the absence of disease. The goal in older adult is to promote healthy aging, even when age-related changes or chronic conditions are present. Wellness involves the whole person, including physical, emotional, mental, and spiritual. With older adults, our assessment focus must shift from a young adult standard of perfect health. Many older adults live with chronic illness yet remain independent, engaged, and satisfied with life. Function, safety, participation, and purpose are the key markers of well-being rather than being completely free of any medical diagnoses. Here we can see several key trends related to global aging. From 2015 to 2050, the global population aged 60 years and older will almost double from 12% to 22%. By 2030, there will be about 1.4 billion people over the age of 60. This number was slated to be 1 billion in the year 2020. By 2050, the population of 60-year-old adults and older will reach about 2.1 billion, and the number of adults aged 80 and older will triple to 426 million. We also see that two-thirds of adults over 60 will live in low and middle income countries. These statistics show that people around the world are living longer, and every country is experiencing growth in the size and proportion of older adults. Aging has become a global health priority, and this increase highlights why gerontological nursing, long-term care planning, and community support systems are becoming more important now than ever. In America, by 2030, over one-third of the population will be older than 65 years. The baby boomer generation now represents the largest group of older adults. Increased longevity means more people will spend a longer portion of life in old age. It's projected that both U.S. life expectancy and the percentage of adults over 65 years will continue to rise for decades. For example, in the 1900s, only about 4% of the US population was over 65. By 2060, this number is expected to reach 24%. Baby boomers are especially influential because they represent the largest living generation and tend to be more physically active than older generations before them, which affects healthcare planning and resource needs. Overall, these trends show that adults are not only living longer, but they're also spending more years in older adulthood. This has major implications for public health planning, long-term care, insurance, housing, and nursing workforce needs. Baby boomers are individuals born in America between 1946 and 1964 during the period following World War II. This era marked a massive population increase, with roughly 76 million births occurring in the United States. And in 1946 alone, there was about a 20% jump in births compared to previous years. Because of this large surge in the number of children, major advancements in public health quickly followed. There was a strong national push for immunizations to protect children from serious infections. And there was also the time when penicillin and other antibiotics were introduced into widespread use, transforming medical treatment and survival rates. Today, baby boomers are entering what we consider chronological late life, typically ages 50 to 65, and many are continuing to live active, independent lifestyles. They also benefited from improved access to medical care, preventive services, and pharmaceutical treatments throughout their adulthood. However, as they age, we are seeing higher rates of chronic illnesses such as dementia, diabetes, arthritis, and heart disease. So, although baby boomers are living longer than previous generations, they are also living with more chronic health conditions, which greatly increases the need for long-term care planning, chronic disease management, and gerontological nursing support. Now let's look at two very unique aging groups called supercentenarians and centenarians. Let's start with the supercentenarians. These are very rare individuals who live to age 110 and beyond. Research shows that many of them share certain lifestyle patterns such as not smoking, managing stress effectively, and maintaining a healthy body weight throughout life. Because of this, they are less likely to develop chronic diseases, and what's interesting is that many remain independent even past age 100. Now let's talk about centenarians. These are adults between 100 and 109 years old. This population is increasing worldwide, largely due to advances in vaccinations, antibiotics, improved medical care, sanitation and hygiene, and also safer living environments. Centenarians survived many childhood illnesses that were once life-threatening, such as the measles, the mumps, chickenpox, whooping cough, and even polio before widespread vaccination. Their longevity is believed to be influenced by both genetics and lifestyle habits. And Japan continues to lead the world in the number of centenarians. It's also noted that the oldest living humans recorded are most often Japanese women. These groups gives us valuable insight into healthy aging and resilience. As nurses, understanding what contributes to long life helps us reinforce preventive care, encourage positive lifestyle behaviors, and support independence for all older adults. As the older adult population becomes more diverse, nurses must understand how culture influences health beliefs, decision making, and aging. Care must be culturally informed and individualized. It should also be free of assumptions. Health outcomes differ by racial and ethnic groups. These differences are linked to factors such as access to care, prevention, social conditions, and historical inequities rather than biology alone. Please review box 3.1 in your T&J textbook for specific examples of health disparities among older adults. For example, Hispanic and Latino adults have the longest life expectancy, while Black Americans have the shortest. The nursing focus should be on identifying individual needs and barriers, communicating respectfully and without stereotyping, providing culturally appropriate education and support, and advocating for equitable access to health services. Older adulthood is commonly divided into 3 stages based on age and typical functional needs. We have the young old, age 65 to 74 years. This group is usually independent, active, and adjusting to retirement. Many remain socially engaged and may still work part-time or volunteer. Health promotion should focus on maintaining mobility, regular exercise, and healthy lifestyle habits. Then we have the middle old, aged 75 to 84. At this stage, we often see increased chronic illness, decreased physical activity, and a higher likelihood of disability or functional decline. A sedentary lifestyle becomes more common, so nursing care should focus on safety, fall prevention, assistive devices, and encouraging modified physical activity when possible. Third, we have the oldest old, that's aged 85 and older. This group experiences the most pronounced developmental challenges, including sensory impairment, frailty, nutritional concerns, cognitive decline, and dependence on others for daily living. Nursing priorities include safety, pain management, nutrition, sensory support, and maintaining dignity and quality of life. Working with older adults, the nurse must speak slowly and allow time for response. Slow your pace and allow extra time for them to process and then respond. Do not rush, interrupt, or finish their sentences. Acknowledge and explore emotional topics. If an older adult repeatedly mentions death, grief, or loss, respond therapeutically. For example, I notice you've talked about dying a few times. How are you feeling about that? Use short, simple statements for cognitive deficits. For example, with individuals diagnosed with dementia or any other cognitive impairment, we want to use short phrases with one idea at a time. Perception is real to them. Promote learning, social connection, and purpose. Encourage engagement in new skills, hobbies, and social interaction to support brain health and emotional well-being. Protect dignity and independence in daily care. Avoid actions that feel infantilizing. For example, do not automatically place bibs on adults. Offer choices and promote their autonomy as much as possible. We also want to encourage regular physical activity, recommending movement that's appropriate to their ability level. The guideline is usually about 150 minutes of moderate activity per week, plus strength exercises, perhaps twice weekly if possible. Elder abuse is any intentional harm or failure to act that causes risk or injury to an older patient. As nurses, we are legally required to report any suspicion of elder abuse to the state agency designated by law. Elder abuse can be physical, such as hitting, pushing, or using restraints inappropriately. It can be emotional, including yelling, threats, or humiliation. Sexual abuse involves any unwanted sexual contact. Exploitation refers to misuse of an older adult's money, property, or resources for someone else's benefit. Neglect occurs when a caregiver does not provide basic needs such as food, hygiene, medications, or safety. And abandonment. That's when a responsible caregiver deserts the older adult or leaves them without necessary support or supervision.